attention, student. I'm going to do a head-to-toe assessment on your child, if that's okay. All right, wonderful, thank you. I'm going to close the door and close the curtain, wash my hands. Can you tell me the name and date of birth of your child? Perfect. And I'm going to start by asking you, are you okay? How was the birth process for you? It was good? Okay, wonderful. There was no tearing or anything that we need to be concerned about? Wonderful. Okay, so is it okay if I sit down? Perfect. So I'm going to start by checking the vital signs. I am seeing that pulse, respirations, and her ox, along with her temperature, they're all within normal limits. And then I'm going to start by checking her head circumference, her chest circumference, and her length, along with her weight. Those are all within defined limits. And then I'm going to check for her body alignment, see if that's symmetrical, and I'm going to check for symmetry and her cry. I'm going to listen to her cry and note that it is okay. It does not sound there's no hoarseness, there's no differences that we should be hearing. Her cry sounds good. And then I'm going to check for her skin. I'm going to check to see if there is vernix, which is the film that comes out on her body when she comes out of the birth canal. If there is some left over, and that's okay if there is. I'm going to check for erythema. I'm going to check for lanugo. I'm going to check for milia. I'm going to check for petechiae, and I'm going to check for Mongolian spots. And then I am going to look at her head. Is it okay if I pick her up? Wonderful. I'm going to check for her fontanelles to see the posterior and anterior. I'm going to check for caput. I'm going to check for molding, and I'm going to check for cephalohematoma. I do not note any of these signs, so that is good. And then I'm going to check her eyes. I'm going to check the color. I'm going to see that they're brown. And then I'm going to get a pen light, and I'm going to see her perla. I'm going to make sure that her pupils are equal, round, reactive to light. They are not going to be accommodating because when she is in your body, there is nothing to come to, so it's not going to happen just yet. I'm going to check to see if she has a lazy eye, and which is okay if she does, and I am going to check her conjunctiva. Good. So then I am going to check her ears, make sure they are symmetrical, there are no obvious issues because that could be related to her kidneys. I am going to check to make sure that they're patent, and then I'm going to make sure that there are no obvious issues. And then I'm going to look at her nose, make sure that the patency is good because she is going to be a nose breather. And then I'm going to look at her mouth. I'm going to take a gloved finger and I'm going to stick it in her mouth, check for the palate, both hard and soft, to make sure it is not detached in any way. There's no obvious issues with that. And then I am going to look for Epstein pearls, and it is okay if there are, we're just going to remove them. And I'm going to look for extra teeth that could be grown into her, which is a thing that we do also have to take out, but it's not going to cause any sort of trauma to her at all because it is not rooted in her mouth. And then I'm going to check her neck, make sure, I'm going to put her down, I'm going to inspect her neck, make sure it is okay, there aren't obvious lesions, marks, anything we should be concerned about, and I do not see anything that is a problem. And I'm going to move down to her chest, and I'm going to see that her nipples are that they are symmetrical, and that there is not a third nipple I have to be afraid of or anything like that. I'm going to measure them, make sure the bulbs are about 2 millimeters wide, And we already checked for chest circumference, so that is good. And then I'm going to listen to her apical pulse, which is going to be directly in the middle of her chest, and I'm going to listen to 1 full minute. And I'm going to make sure that there aren't any murmurs or anything we have to be worried about. And then I'm going to check her respirations. I'm going to do all sides. Her lungs sound great. And then I'm going to move down to her abdomen, and I'm just going to look at her umbilicals. And I'm not going to be able to see, but there are 2 arteries and 1 vein. And right now I'm just looking to see if there's any signs of infection, which there are not. Great. There's no redness, no swelling, no drainage. Okay, and then I'm going to auscultate her abdomen, because her bowel sounds will be active as soon as she is born. Bowel sounds sound good. And then I'm going to ask, has she been voiding well? She has been having a bowel movement, and her bowel movement does look a little different than what it usually would. First bowel movements are always going to be, they're going to be dark and they're going to be runny. So I just wanted to make sure she had a bowel movement. Wonderful. And urination frequency, amount. I looked in her chart, it all seemed normal and wonderful, perfect. And so then I'm going to move her, and I'm going to take off her diaper, and I'm going to make sure that her genitals are good. There isn't any discharge. And I'm going to make sure her labia minora and labia majora are intact and they're covering what needs to be covered, which is great. It's all signed perfectly. I'm going to turn her over, and I'm going to look at her spine. Her spine, make sure all of her cervical columns are good. There's no like lesions or anything that could be a concern. I'm going to check her anus, make sure that patency is not an issue. It's not, so it's wonderful. Hey baby, I'm going to put you down. And then I'm going to check her extremities. So I'm going to check her range of motion and her muscle tone in both. And I'm going to check for hip dislocation, so I'm just going to move her all like that. And I'm going to listen to see if there's any cracking sounds, because then we'll have to do some scans that'll point to hip dislocation. And so then I'm going to check her toes, make sure her fingers and toes are all good. Toes are good, fingers are all good. And then I'm going to check for her reflexes. So I'm going to put my hand right here, and she should be following my hand. And then I can do her, I can check for her sucking and swallowing reflex when she is drinking from a bottle or from a breast. And then I'm going to be putting my finger right over her fingers and see if she will grab them, both hands. And then I'm going to put my finger right here and see if she can grab my fingers. Right here, see if she can grab my fingers. And then I'm going to do a startle test, which is just, I'm going to lift her up a little bit, and I'm going to pretend like I'm going to drop her, and she will become startled. And then I'm going to do the Babinski reflex, which when I will do this, her toes will go like this. This is not a normal sign on an adult. It will be only for the babies. If there is a sign on the adult that is in this, that if an adult tests positive for the Babinski reflex, it's usually the sign of a neurological deficiency. And then I'm going to check her back, make sure that she can curve it. And I'm going to go like this, and she's going to go like this. And then I'm going to rub this side, and she's going to follow her hand the way that I go. Okay. And I am also going to note if there are any issues with her behavior. So I don't see anything. She's not crying. She's not restless. She's sitting there normal. She is happy. She is content. And so that is wonderful. Okay. Or is there anything that you need from me? No? That's wonderful. Okay. Perfect. Thank you so much.